Hello, this is Debbie Seidel-Bickey. I'm the CEO of Dental Practice Solutions, and I wanted to talk to you about something today. It's September, and it's the anniversary of my mother's birth. And I wanted to share something with you that I feel is very important. You see, in 2002, she had her mitral valve replaced. You might have heard my story before, but I wanted to dedicate this month and this video to her, my mother, Pauline Seidel. And what happened was she had her mitral valve replaced and then finally came in to see me, her hygienist, on a Saturday, and I found a perioendo abscess, and my doctor extracted her tooth. She had a bridge placed, and at the time I wasn't there in the office, but she had the bridge placed, but she never ever felt good. It was like she had the flu. Long story short, she ended up passing away several weeks after she had the bridge placed because she had a hemorrhagic stroke, which led to her kidneys failing, and it was endocarditis that she actually had that caused all these problems and ended her life. And I wanted to ask you, what is it that you're doing when your patient comes in and reviews the medical history? Now, I hope that every single time your patient is seated there, whether they just came in and had a hygiene routine appointment, that when they come in to see the doctor a week or two later, somebody's still reviewing that medical history. And it's very important that you update that. Some of our clients have their patients fill out a new history and HIPAA and a change of appointment policy and even a smile evaluation every year. How often is your office updating that health history? And beyond the health history being completed, what other questions are you actually asking your patient? Is it possible that they forgot to put something down? Is it possible that they had a surgery, and until you actually verbalize, have you had any surgeries? Are you taking any blood thinners? Are you, in any pain? I mean, it's possible that they haven't asked these questions on the health history, or that they didn't think to answer them. Just like in my mother's situation, I'm not really sure that anybody reviewed her health history thinking it's Debbie's mom. And did they ask her, did you have a recent surgery? Do you have a heart condition that requires you to take an antibiotic before your dental appointment? There are specific questions. You might want to know if they're taking any other herbal supplements, which could also have some excessive hemorrhaging while the procedure is being completed in your office. So I wanted to invite you to meet with your team and just discuss what kind of questions you're asking your patients beyond just them completing a health history. Talk to each other. Talk to your doctor and find out how often does doctor want that health history, a new health history, completed. And what questions do you ask as that patient seated in your chair? We recommend that the clinician who seats the patient sit down, have a seat, knee to knee, eye to eye, and review that medical history, asking additional questions. Any surgeries, any blood thinners that you're taking? Have you had any heart issues that we should know about? Do you need to take any medications prior to any dental procedures? These types of specific questions need to be asked so that you don't end up losing a loved one due to something tragic as my mother's situation. I want to wish you a great week. I will be back next week. And by the way, check over on our Facebook page. It's facebook.com /Hygiene Profits. We are having some Facebook Lives there on Thursdays in September at 5:30 p.m. and it's Pacific Standard Time. I hope you'll join us over there. I'll be there with my colleague Doug Fettig of Aldrich Advisors, and we'll be asking and answering your questions about how you can end in the black in 2017 and start out with a big bang with productivity and profits in your bank account in 2018. I will see you soon. Thanks for joining me today. Bye for now.